Hi everyone, welcome again to another episode. This is the last video, alright, on infertility. So, in this video, I will be sharing practical steps on what you can do before you start going to look for assisted reproductive technology, that's IVF, IUI, and whatever other complex form of management is. First off, there's something called the fertility window or fertile window. Now, what is that? I'm not going to tell you everything that there is, but I just want to give you an overview. First off, for a woman, it's very easy to understand her system because she has a cycle called the menstrual cycle that literally tells you everything that's going on in her system. Unlike the male, where we don't typically have a cycle, but we have certain things that happen. Unlike the male, where we don't have really a cycle, but we have testosterone that goes up at certain times of the day, and then it comes down at certain times of the day. If you want to know what that is, of course you have to come and talk to me. I'm not going to tell you everything at this point. So, what is the fertile window for a woman? This is the idea. It's easy if a woman has a regular menstrual cycle. If her cycle is irregular, it's difficult to tell. But if it's regular, it's easy to tell. First thing, ask yourself, how many days is my menstrual cycle? I didn't say period, menstrual cycle, the entire cycle. From the first day you start seeing blood to the next day you start seeing blood, that's the entire cycle. So if you have, on average, a 28-day cycle, what you do is subtract 14 from 28, that's your ovulation day. So the day of ovulation, 5 days from it, and 1 day after it. That is your fertility window. What does that mean? That means within this period, you have the highest chance of getting pregnant. Outside this does not mean you will not get pregnant, but the chances are slim. This is what science has taught us, all right? So to increase your chances of getting pregnant, engage in very good sexual intercourse within that period. So the first thing you need to know is, when am I ovulating? Because ovulation, like I said, is the presence of the egg. The egg leaves the ovaries, goes through the fallopian tubes, and stays waiting for fertilization. Now, why do we say 5 days before? Because that's how long it takes. Or let me put it this way, that's how much time the sperm can live. They can live for up to 5 days. So they can, if a man engages in sex 4 days before ovulation, she can still get pregnant. If he engages in sex 3 days before ovulation, she can still get pregnant. Or a day after it, because the egg is only viable for 1 day. So if you have had issues, maybe a couple of months trying to get pregnant and you found that it's been difficult, you haven't gotten pregnant yet, find out what time of the cycle you are actually engaging in sexual intercourse. That's number one. Number two, mental stress, emotional stress. These two, they greatly affect the ability to conceive. If you and your spouse are mentally stressed, emotionally stressed, not even available, all you're just thinking about is, okay, let's have sex so we have a baby, the chances are you're not just gonna have one. In fact, if I ask you a question, to be honest, not you, but you know someone who engaged in sex before they got married and they got pregnant without even thinking. And then now they got pregnant, they've gotten married, and now they've gotten married, and it's like difficult to get pregnant again because now there's all that pressure. We have to do this, we have to get pregnant, we have to show that we are a fertile couple. Get yourself off of that, right? Relieve yourself of all that stress because it actually adds to the reason why it's difficult for you to get pregnant. All right. Now, if you are already doing that, you're maintaining regular sexual intercourse. Now, the question is, should I not have sex outside of the window? Of course you do. But it's just that to increase your chances, do it in the fertile window. Now, after that is done, that is said and done, what's the next step if we're already doing all of this and still we're finding it difficult to conceive? That's when you seek help. The idea is do everything that you can that you're supposed to. And if it still not works, then seek help. So when you're seeking help, it should be taken in levels from primary to secondary to tertiary. What does that mean? Primary means you talk to a GP, a general practitioner. He gets to ask you a couple of questions. They take family history, try to understand what you've been doing, your medical history, gynecological history, try to understand how your systems have been. Are there any pointers to any problems? If you've been treating recurrent infections, if you have any history that could be a problem, could be a marker or a pointer to the reason why it's difficult, that doctor will help you understand it. Then they run basic level tests. Now, what are these kind of tests? When you come here, I'll tell you exactly what those tests are, because every person is different. And if I tell you this online, I'm sure some of you would just jump up and do this, and it won't be correct. So it has to be tailored to your particular situation. So there are a group of tests, not just lab tests, but there are radiological imaging as well. That includes an ultrasound. So over here, there is not just the first ultrasound to just check how the female organs are and then be fine, but there's also something called follicular tracking. So it literally tracks how the eggs are growing within the ovary, and then it tells you when you're ovulating, because some of you ladies don't even know when you're ovulating. And it's not just your fault, not just ignorance, but sometimes the menstrual cycle keeps changing, and because of a lot of issues, a lot of different possibilities as to why that is. So follicular tracking helps you to understand when is the best time to engage in sexual intercourse. Some people have issues with ovulation, some people have issues with their ejaculation, with the quality of the sperm and all of that. That's in the secondary test. You do a hormonal analysis, you do a semen analysis, they check up for every other possibility of why you both are having difficulty. Now, the tertiary is where you go to the assisting. We're trying to figure out what is the best way possible. Some people may need surgery if they have blocked tubes, or some kind of anatomical structures that are causing the problem of fertility. And some people will definitely need the ART. That is assisted reproductive technology, which includes the IVF, the IUI, and every other procedure that could help a family or a couple to get pregnant. All of these are available at different centers, but to get the best form of help, you need to go to a specialist. A GP or family medicine, or someone in, just general practice, that's the GP, can be able to tell you different things possible, but only when you have the right type of information from a specialist can you be sure that you have everything in place. So what I'm saying is, there are things that you should do on your own before you seek help. After you do that, then you seek help. When you seek help from the right people, all right? Get everything possible before you spend money. You know that money is a big issue now, so before you spend that money, get everything that you need, basically. So, come to Chem Health and Diagnostics Center. Of course, that's where this video is going to, because I want to not just talk and keep talking and talking, but I want to give you every basic information you need. I want to help you on your journey so that you can achieve the conception that you so dearly desire. Thank you for following me through these episodes. Do have a great day, and I hope to see you very soon in Chem Health and Diagnostics Center. Bye.